Hi, my name is Elle Thigpen. I'm a senior volleyball player at UNC Asheville. I first started playing volleyball in 5th grade. I used to cheer before that, and I needed a change because it just was not my vibe. So I started playing volleyball. I learned through my cousin, and my mom played. When I was in middle school, my mom woke up one night having a lot of stomach pain, throwing up, a lot of that. So my dad took her to the hospital and she told them how she felt, and the doctors basically told her she's probably just experiencing a lot of anxiety. If you know my mom, she's very independent. She uses her voice when needed, and so she didn't end up leaving the hospital. They ended up doing a lot of scans and figured out she actually had a tumor. So after that, she was able to get chemo treatment and move forward with that, and she's well aware, we're very well aware that she lives a very privileged life, and I think after experiencing that, I was able to see a lot of people in that hospital that weren't able to access that treatment and that care because they just didn't have health care for it. They didn't have people supporting them. They didn't have the financial ability. That experience opened my eyes to just a lot of areas in the community that do need help. I took a few classes in the health science field, and I saw how I really appreciated the education that they gave around a holistic health care field that we need in the world. And I also took a developmental psych class, and I saw how interested I was in learning about why people feel, think, and believe the way that they do. So I wanted to kind of put them together and see what I wanted to do from there. So I completed an internship with All Souls Counseling Center. They're a nonprofit community health organization in Asheville. I completed another internship with Planned Parenthood South Atlantic, the director of philanthropy in Asheville. I was really grateful to do a big internship with them over the last semester because they gave me a lot of autonomy in what I wanted to do. I was able to talk to many clinical mental health clinicians and therapists, counselors, and the director that works there. I was able to learn from their experiences. What's really important for me with pursuing mental health education is providing resources to people, so they allowed me to go free rein on what I wanted to show to the people that were on their Instagram. So I made Canva posts that showed education for suicide prevention, diversity, equity, and inclusion, women's health care. I worked with their director of philanthropy, and I was able to go to a lot of donating events that they had, learn from their donors, their community-based organizations that help them function. They're a nonprofit, so they can't really function or give health care to people if they don't have money for it. So I was just learning the processes behind that. I was able to go to different educational sessions with different religions and learn from them as well, and through that experience I was able to see how passionate I was for abortion access and sexual reproductive health care. My last internship was with the mental health coordinator here, Dr. Jones, in her stress management biofeedback lab. We worked together on working on her heart rate variability equipment that she had, so I was able to learn from her, use it on myself. I was able to learn what biofeedback even means. So it's a technique to kind of read how your body is reacting to stress and trauma around you. So I was able to see how I was reacting to stress and trauma in my life, and with that we were also working on helping out the mental health ambassadors that we have here, planning new things for them and trying to get the mental health ambassadors a way to learn just like I was able to over that semester. We began this project the beginning of the semester, and our goals were to spread awareness and find the intersections between trauma, low access to resources, internalized stigma, and how all of those connect with the unhoused population's experiences. We had to kind of revamp the project a little bit because of Helene, and now we're focusing on how low socioeconomic individuals are impacted by natural disasters and trauma that comes with that. And our goals are to spread awareness of the experiences that low socioeconomic individuals have through that trauma, and what policies and education awareness all combine in order to reduce those disproportionate experiences that they have. What's kind of missing in the world is a full holistic approach of education towards mental health experiences. In school, we really learn or we don't really learn much before college of how your body reacts to stress, what happens when you experience trauma, and through working with my different internships, I was able to see how different populations are experiencing trauma and just adverse experiences as a whole. It just kind of made me more passionate to make a change. My role is an executive officer for the Menstrual Equity Club. We meet once a week. We just discuss the areas of campus and in the world that need more education, more resources towards menstruation, and along with that, just even saying the word helps because it's seen as very taboo. So we give resources and supplies to people on campus. We have educational sessions, and we just kind of work together to provide a space to talk about sexual and reproductive health care without being judged. Right now, my plan is to get my master's in social work, so go to school for that, either become a clinical social worker, so giving people therapy, going into the community, giving them educational sessions on things like I said earlier on how stress impacts the body, what barriers to mental health care there are, or even pursuing my PhD.